Introduction. Arthritis is an inflammatory condition of the joints. Spondyloarthritis is a type of arthritis in which the enthyses, the connective tissue between the tendons or ligaments and bone, are affected as well. Spondyloarthritis mainly affects the spine, but can also involve other joints and may be associated with other conditions that affect the skin, intestines, and eyes. Spondyloarthritis mostly affects young males in their teens and 20s. There are several types of spondyloarthritis. The most common type is ankylosing spondylitis, a condition which affects the vertebral joints, causing the bones to fuse, making the spine stiff and painful. Axial spondyloarthritis mainly affects the spine and pelvic joints. Peripheral spondyloarthritis affects the joints of the arms and legs. Reactive spondyloarthritis is an immune reaction to a bacterial infection, such as a genital or urinary tract infection. Psoriatic spondyloarthritis is associated with a skin condition called psoriasis. Enteropathic spondyloarthritis is associated with inflammatory bowel disease. Causes. Spondyloarthritis is usually a hereditary condition associated with several genes, most commonly a gene named HLA-B27. Enteropathic spondyloarthritis may be caused by bacteria that enters the inflamed intestine. Signs and symptoms. Spondyloarthritis can lead to pain, stiffness, and fatigue. It commonly causes low back pain. Symptoms may be constant or may increase or decrease in severity. Spondyloarthritis can lead to spinal deformity and loss of function of the hips and shoulders. Those with spondyloarthritis may also develop other conditions, such as osteoporosis, a weakening of the bones, uveitis, a kind of eye inflammation, and aortic valve inflammation. Diagnosis. To diagnose spondyloarthritis, your doctor will review your medical and family history and perform a physical examination. Imaging tests may be ordered to examine the joints. X-ray of the sacroiliac joints of the hip usually shows inflammation. An MRI may be ordered if X-ray imaging isn't clear. A genetic test may be performed to see if you have the HLA-B27 gene. Treatment. To treat mild spondyloarthritis, your doctor may first recommend nonsteroidal anti-inflammatory drugs, or NSAIDs. Corticosteroid injections may be administered into the joints or tendon sheaths if localized inflammation is present. If you do not respond well to these medications, your doctor may recommend disease-modifying anti-rheumatic drugs, or DMARDs, which control symptoms and prevent joint damage, or biologics such as tumor necrosis factor inhibitors, which are newer and more effective medications. Treatment for reactive arthritis will involve the use of antibiotic medications. Your doctor will recommend physical therapy to decrease pain and improve joint health. This can include exercises to improve spinal extension and mobility. Smokers are advised to quit, as smoking can worsen symptoms and promote spinal fusion. Surgery may be recommended when there is significant loss of joint function due to excessive cartilage and bone erosion. Your doctor may recommend a total hip replacement. Spine surgery is rarely recommended, but may be performed to straighten deformities of the neck. Summary. Spondyloarthritis is a type of inflammatory arthritis that also affects the connective tissue between tendons or ligaments and bone. It mainly affects young males in the teens and 20s. Adequate treatments are available to help those with spondyloarthritis lead active and productive lives.